A wasp sting can be a painful and alarming experience, especially if you are not prepared for it. While wasps are typically not aggressive, they can sting when provoked or when they feel threatened. Understanding what to do when stung by a wasp, how to alleviate pain, and when to seek medical attention can make all the difference in reducing the discomfort and preventing serious complications. This video will provide an in-depth look into what happens during a wasp sting, how to provide immediate relief, and what to do afterward to ensure a safe recovery. A wasp sting occurs when a wasp injects venom through its stinger into the skin. Unlike bees, which can only sting once because their stingers are barbed and get stuck in the skin, wasps can sting multiple times as their stingers are smooth and can easily be withdrawn. The venom injected by the wasp contains a mixture of toxins that cause immediate pain, inflammation, and redness around the sting site. The venom can also trigger an allergic reaction in some individuals, which could lead to more severe symptoms such as swelling, dizziness, or even anaphylaxis, a life-threatening condition. The severity of the sting depends on several factors, including the location of the sting, the amount of venom injected, and the person's sensitivity to the venom. The first step after being stung by a wasp is to remain calm. Panic can increase your heart rate and cause the venom to spread more quickly through your body. It's important to assess the situation and evaluate whether the sting is a minor irritation or something that could lead to a more severe reaction. If you are stung and you feel lightheaded, dizzy, or notice difficulty breathing, you may be experiencing an allergic reaction, and it is crucial to seek immediate medical help. In the case of a mild reaction, however, the sting can usually be managed at home with some basic first aid steps. The first thing to do after a wasp sting is to remove the stinger if it is still present. While wasps don't leave their stinger behind as bees do, it's important to check the sting site. If there is a stinger visible, use a flat object such as a credit card or your fingernail to scrape it out. Avoid using tweezers or pinching the stinger, as this may squeeze more venom into the wound, increasing the pain and swelling. Once the stinger is removed, the next step is to clean the sting area to prevent infection. Wash the affected area gently with soap and water, being careful not to irritate the skin further. After cleaning the sting site, applying a cold compress can help reduce swelling and pain. Cold temperatures cause blood vessels to constrict, which can reduce inflammation and numb the area. You can use an ice pack, a cold washcloth, or even a bag of frozen vegetables wrapped in a towel to create a cold compress. Apply the cold compress to the sting site for 10 to 15 minutes at a time, ensuring that you don't apply it directly to the skin to prevent frostbite. Repeating this process every few hours can help minimize swelling and provide temporary relief from the pain. In addition to cold compresses, there are several over-the-counter remedies that can help alleviate the discomfort of a wasp sting. Antihistamines, such as diphenhydramine Benadryl, can help reduce itching and swelling caused by the body's allergic response to the venom. Be sure to follow the dosage instructions on the package, as taking too much can lead to drowsiness or other side effects. Topical treatments like hydrocortisone cream or calamine lotion can also be applied to the sting site to relieve itching and inflammation. These creams help to soothe the skin and provide a barrier to prevent further irritation. You can also use baking soda or a paste made from vinegar to help neutralize the acidity of the venom and reduce discomfort. For pain relief, non-steroidal anti-inflammatory drugs and NSAIDs such as ibuprofen or aspirin can be taken to reduce inflammation and alleviate pain. Always follow the recommended dosage and avoid giving aspirin to children under the age of 18, as it can cause a rare, but serious condition called Ray's syndrome. If the pain and swelling do not subside with these treatments, or if symptoms worsen, it may be necessary to seek medical attention. While most people experience only mild symptoms after a wasp sting, some individuals are at risk of having a more severe allergic reaction. An allergic reaction to a wasp sting occurs when the body's immune system overreacts to the venom. Symptoms of an allergic reaction can range from mild to life-threatening and may include swelling of the face, lips, or throat, difficulty breathing, nausea, vomiting, dizziness, or a drop in blood pressure. If you notice any of these symptoms after a wasp sting, it is essential to seek emergency medical help immediately. Anaphylaxis can progress quickly, and without prompt treatment, it can be fatal. Individuals who know they are allergic to wasp stings should carry an epinephrine adrenaline injector, commonly known as an EpiPen. Epinephrine works by rapidly reversing the effects of an allergic reaction, including narrowing the blood vessels, or reduce swelling and increasing blood flow to vital organs. The injection should be administered as soon as symptoms of an allergic reaction appear. After using the EpiPen, the person should be taken to the hospital for further evaluation, as the effects of the epinephrine may wear off, and additional treatment may be necessary. For those who are not allergic to wasp stings, the pain and swelling from a sting usually subside within a few hours to a few days. However, some people may experience a delayed reaction, such as prolonged itching or redness at the site of the sting. If the pain continues for an extended period, or if the area becomes hot and increasingly red, this could be a sign of infection. In such cases, it's important to seek medical attention, as untreated infections can lead to complications. A doctor may prescribe antibiotics if an infection is present. To prevent future wasp stings, it's helpful to take some precautions when spending time outdoors. Wasps are attracted to sugary foods, bright colors, and floral scents, so avoiding brightly colored clothing, strong perfumes, and sweet-smelling foods can reduce the likelihood of attracting them. If you encounter a wasp, try to remain calm and move slowly. Rapid movements or swatting at the wasp can provoke it and lead to a sting. If you are allergic to wasp stings, consider wearing a medical alert bracelet and informing those around you about your condition. While most wasp stings are not life-threatening, it's important to treat them seriously and know how to manage the symptoms effectively. Immediate relief can be achieved through cleaning the wound, applying a cold compress, and using over-the-counter treatments to reduce pain and swelling. However, if you experience more severe symptoms or signs of an allergic reaction, it's important to seek medical attention immediately. By taking the right steps after a wasp sting, you can reduce your discomfort and ensure that any potential complications are addressed quickly. With the right knowledge and preparation, most people can recover from a wasp sting with minimal issues, but understanding when to seek professional help is crucial for those who are more vulnerable to severe reactions.